Welcome to this edition of Health Update. I'm Kathy Clark, Director of District Health Services at Indian Hill High School, and your host for today's program. How many of you know what the game Chaturanga is? I'll give you the answer in a few minutes, but first some clues. It was invented around 600 AD in India and was referred to as the brain game. We still play it today, and it's still a very brainy game. That says a lot, because the brain is the most complex organ in the body. It performs the enormous task of processing all the information taken in by all the senses, and it directs the function of all the other organs. And for some of us, it acts as the seat of intelligence. The week of March 15th through the 21st has been designated Brain Awareness Week. For that reason, Dr. Marvin Rohrich has been asked for time to present some information to you regarding our brains and how to keep them safe. Dr. Rohrich is a neurologist at River Hills Healthcare, works at Bethesda North, Christ, and Jewish hospitals. He graduated from MIT and went to UC Medical School. He has 2 children, both students in the Indian Hill School District. Also with us are a few of our high school students as guests to participate in our discussion with Dr. Rohrich on this topic. At this time, I present Dr. Marvin Rohrich.
Thank you very much, Mrs. Clark. It's a pleasure to be here today to talk to you about concussion, because concussion is the topic which is probably most familiar to people that are in high school. And as a way of emphasizing Brain Awareness Week, I thought it would be nice to come to you and talk a little bit about facts having to do with concussion. First, I'd like to thank you for the opportunity to come before the audience and present some facts about concussion to the school. I think you have a great opportunity here, and my daughters are very happy with the school too. We know when we participate in athletic activities that there may be sports-related injuries, or there may be injuries that occur outside of school that may come to the attention of Nurse Clark. But today we're going to talk a little bit about what is a concussion and when concussions occur. The definition of a concussion is an alteration of mental status due to biomechanical forces affecting the brain. A concussion may or may not cause loss of consciousness. Typically, severe concussion is associated with a more lengthy loss of consciousness, and a mild concussion, little if any loss of consciousness. But there can be some behavioral changes that indicate that you may have suffered a concussion. Some facts about concussion. First, the Centers for Disease Control and Prevention estimate over 300,000 sports-related concussions occur per year, and of these, over 100,000 of them occur in football games alone. Football, ice hockey, soccer, both men and ladies soccer, wrestling, basketball are just a few of the sports that we participate in which a concussion may occur. You're probably very familiar also with concussions that may occur as a result of automobile accidents. In the anatomy of a concussion, the cartoon here shows the brain within the skull and showing that the brain is a soft substance which is vulnerable to outside trauma. The skull protects the brain against the trauma, but does not absorb all the impact forces. I brought a skull to show you how the brain is protected by the durable and hard cranial vault, so that the protection to the brain is multi-faceted. Really, the scalp and soft tissue under the scalp protect a little bit, but the bony skull is the major protection to the brain, and the spinal cord exits through the hole in the base of the brain to the cervical spinal canal, which is also certainly of concern in anybody who's had a head injury. You want to make sure that the brain itself is spared from injury, and in a concussion we think that the brain seen here is subject to physical or mechanical forces that move it within the skull, causing some of the behavioral changes that we see in a concussion. The vulnerable tissues in the brain are the white matter of the brain and also the gray matter, which is on the outer cortex. The nerve and their sprouting axons are seen in this, and they have axonal processes that go deeper into the brain to go to secondary centers where the message is then transmitted further through the spinal cord. When the brain is shaken or subject to forces, the electrical conduction may be altered, and that's the mechanism by which a concussion causes some of the behavioral changes that we can see. The immediate signs of concussion, which may occur within seconds or minutes, are certainly most commonly seen as impaired attention, sometimes a vacant stare or an inability to concentrate, delayed responses. Sometimes people will complain of impaired vision or loss of focus. Slurred or incoherent speech can be seen in the first minutes after a concussion. Their rate of mental processing often will be slowed, and so their speech may be affected. The incoordination of the arms or legs is another feature which can be seen immediately after a concussion. Disorientation, certainly we're familiar with a person who on the football field goes to the wrong side of the field or is not quite with the huddle and seems to be slowed in their getting back into the game. These symptoms are often significant. Emotional reactions out of proportion to the circumstances, such as anger or irritability, can sometimes be seen shortly after a concussion and are symptoms to look for after someone's had a head injury. Memory deficits are particularly important to look for in the school-age student who may have difficulty remembering material, say on a test that may be administered a day or two, or even on the same day as a mild concussion has occurred. Any loss of consciousness is a sign that the concussion may be more serious. If the person is dazed but not unconscious, it's usually less serious than if they've been unconscious or motionless for a period of seconds to minutes or even longer. Certainly a concussion where a loss of consciousness lasts more than several minutes would usually require the evaluation by a physician and in some cases by a neurologist. Later signs of concussion are commonly seen, and they may consist of persistent headache, dizziness or vertigo, poor attention or concentration, memory disturbance, nausea or vomiting, and easy fatigue. There may be other symptoms such as irritability or intolerance to bright lights, and a whole host of others that are symptoms of a post-concussive syndrome. And the duration of this syndrome can be for varying lengths of time, sometimes up to weeks or even months. We can see intolerance to loud noises, irritability, depression or anxiety, sleep disturbances among the symptoms of post-concussive syndrome. These lingering symptoms and mild cognitive impairments following a concussive injury are associated usually with the more severe degrees of concussion, what they term grade 2 or grade 3. There is a second impact syndrome, which is the phenomenon of a second concussion occurring while the patient has not yet fully recovered from the first. And this is a type of syndrome that may be seen more often in a contest of an athletic nature where there may be subjected to repeated blows. So the person who's not taken out of the game may suffer another injury. The classic example is probably boxing, where someone is subjected to a rather significant blow and is in the stage of recovery from the first mild concussion, and then they are dealt another blow, which is often the technical knockout blow. These symptoms may cause more delay in the healing process, but still a loss of consciousness is not required, but the person is potentially at risk to develop late complications and should be watched closely. Brain swelling is a phenomenon that we sometimes worry about, as well as intracerebral hemorrhage, being the result of shearing forces due to the concussive impact that we must be on the lookout for, and sometimes a CT scan of the brain or other imaging studies may be necessary to make sure that such a more severe injury has not occurred. They mentioned that this can be fatal, and that's usually because there can be a rupture of some of the small blood vessels on the surface of the brain that can cause leakage or delayed bleeding that will build up pressure inside the skull and cause this type of injury. There's a higher risk of long-term cognitive dysfunction in second impact syndrome, and people who are subjected to repeated concussive injuries over a career, for example, as you might have in professional sports or in boxing, may be injurious and not really understood as to how injurious until later in life when they may suffer from early dementia. The picture here shows the brain and the spinal cord, and the most serious of injuries that can be associated with a concussion is the formation of a hematoma or blood clot, either on the surface of the brain, on the left or right side, or in the back part of the brain, the cerebellar region. A contusion is what we refer to as a brain bruise, and this can be associated with some little small capillary ruptures and some bleeding in the brain. Brain swelling is usually when the forces are more severe, as you might find in an automobile accident at high speeds, causing a diffuse swelling of the brain, which is very, very dangerous and usually will require hospitalization to follow. How is a concussion assessed? Well, the American Academy of Neurology has guidelines for sideline evaluation. There is a standardized assessment of concussion for sideline use. Note that they use the word sideline. They're usually talking about football injuries. We can use standard neuropsychological testing. For example, asking people questions of orientation, having them read a paragraph, trying to remember what they read, mathematical calculations, other formal cognitive operations can be evaluated by a neuropsychologist. Computerized reaction time tests will determine if there's a delay in mental processing, sort of like a complicated maze test. When you learn the maze, it's much easier and you go through more quickly. After a concussion, the time it takes to complete a maze test is much increased.
Dr. Orrick, you've given us a lot of information. I'm wondering if the students have any questions at this time.
Thank you. Be happy to answer any.
Yeah, I have a question. Can you suffer a concussion without a serious blow to the head?
Without well, you mentioned a serious blow to the head.
Or any type of blow to the head?
Usually a concussion does require that physical impact. So if you fell, for example, off a roof and landed on your head, or if even you fell backwards on the ice and hit your head, you could sustain a concussion. Usually there is a physical or mechanical impact.
Should you take any medicine after you've had a concussion, or should you seek medical help?
If you're having severe headaches immediately after the concussion and you are doing well, but you have a headache, if 1 or 2 days have elapsed and you've been, as an outpatient, going to school, probably taking Tylenol or aspirin's fine.
One more question.
Yeah.
If you have a minor concussion and you don't seek help, like, are you making it worse, or does the help need to be sought right away, or?
As you may have experienced, if you go to a hospital emergency room having had a concussion or having had a head injury with a wound to your scalp, they will give you a head injury checklist, which consists of making sure that you have no complaints of vision, behavioral change, weakness in an arm or leg, things of that sort. So it is important for you to be observed by a family member or by someone that knows you to make sure that you're okay.
Okay.
I have a question, actually. Very often kids come in the clinic following a head injury, and they will complain of the headache, but they'll say it's not in the area that I sustained the injury. Could you talk about that for a minute?
Well, the concussive forces often are transmitted through a sudden movement, and it may involve the entire brain shifting rather than just the area where the brain received the impact. So while the impact may be on one side, the whole brain has moved as a result of that, and so the entire brain may have a mild injury, and so the headache can often be quite diffuse, whereas the cut or the hematoma on the scalp may be in a location where they struck the surface.
Okay. Great. Anyone else have any other questions? Is there
Yeah.
anything else you'd like to present?
You have a question?
What causes someone to go into a coma?
What causes a
Coma?
coma? A coma is considered a prolonged change in consciousness, which is associated with inability to respond to verbal or tactile stimuli, and there are different grades of coma. So the word coma has got different shades, from being semi-conscious, or where you're not really able to speak, all the way to brain death. So the severity of the injury may be so bad as to cause coma, where there's a differing degree of severity of symptoms. It all depends on the severity of the brain swelling, if there is, or bleeding in the brain, if that could occur.
What can make someone come out of a coma?
Well, if there's bleeding on the brain, there can be resolution of the blood and healing. And when the structural electrical processes in the brain recover sufficiently, there may be arousal of the cortex so that someone could wake up.
Dr. Rourke, thank you so much. I wish we could go on. There's lots of other questions that I know need to be asked. On behalf of the students and faculty of Indian Hill High School, I would like to thank you for your time and information. For those of you with a burning desire to know what Chaturanga is, it's the game chess. And to all of you, be safe.